The information provided in this video is for educational purposes only and is not intended as medical advice. Please consult with a healthcare professional for medical advice, diagnosis, or treatment. Hello everyone. Welcome back to my channel. Today we are diving into the complex and often misunderstood mental health condition of schizophrenia. We'll cover its definition, core deficits, epidemiology, pathogenesis, evaluation, and both non-pharmacological and pharmacological treatment. Let's get started. Schizophrenia is defined as a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may think like they have lost touch with reality, which can be distressing for both them and their loved ones. The core deficits of schizophrenia can be characterized into three main areas. Positive symptoms. These include hallucinations, delusions, thought disorders. Negative symptoms. These involve a lack of motivation, reduced emotional expression, and social withdrawal. Cognitive symptoms. These affect memory, attention, and executive functions. As for the epidemiology of schizophrenia, it affects approximately 1% of the global population. It typically manifests in the late adolescence or early adulthood, with men often showing symptoms earlier than women. The disorder is often found across all cultures and socioeconomic groups. The pathogenesis of schizophrenia involves a combination of genetic and non-genetic factors. Schizophrenia has a strong genetic component. Individuals with first-degree relatives with schizophrenia have a higher risk of developing the disorder. Specific genes and genetic mutations have been linked to the increased risk. As for the non-genetic factors, these include environmental factors, which play a crucial role. These include prenatal exposure to infections, malnutrition, and stress, as well as psychosocial factors like childhood trauma and substance abuse. Diagnosis of schizophrenia involves a comprehensive evaluation, including clinical interviews to assess the symptoms and their impact on daily functioning, psychiatric assessments to rule out other mental health conditions, medical tests to exclude medical causes of symptoms. These tests may include blood tests to check for conditions that mimic schizophrenia, such as thyroid disorders or substance abuse, brain imaging, which includes MRI and CT scans to rule out brain tumors or other structural abnormalities, electroencephalogram to detect abnormal brain activity that could indicate other neurological conditions. Also, check the family history to identify any genetic predispositions. Let's talk about the non-pharmacological treatments. Non-pharmacological treatments are essential for managing schizophrenia and improving quality of life. These include psychotherapy, particularly cognitive behavioral therapy, can help patients manage their symptoms and develop coping strategies. Social skills training to enhance social interactions and relationships. Rehabilitation programs to support vocational and daily living skills. And additionally, family therapy to educate and support the family members. Pharmacological treatment, which means medications, are also a cornerstone of schizophrenia treatment, and they're actually one of the most important treatments of schizophrenia. These include antipsychotics. These medicines help reduce the severity of psychotic symptoms. They are classified into first-generation antipsychotics and second-generation antipsychotics, also called atypical antipsychotics. The first-generation antipsychotics include haloperidol and chlorpromazine. These are effective but may cause more side effects like tardive dyskinesia. As for the second-generation antipsychotics, these include risperidone, olanzapine, and clozapine. They tend to have fewer side effects and often are preferred for long-term treatment. Additionally, mood stabilizers and antidepressants may be used to address co-occurring mood disorders such as bipolar disorder or depression. Long-acting injectables for patients who have difficulty with adhering to daily medication regimens is extremely important. Long-acting injectables like paliperidone can be administered every few weeks or months. Please consider LAI or long-acting injectable, LAI, right away during hospitalization to improve medication compliance. Adjunctive medications sometimes include additional medications like benzodiazepines, beta blockers, to manage anxiety and agitation. In conclusion, schizophrenia is a complex disorder that requires a multifaceted treatment approach. With the right combination of therapies and support, individuals with schizophrenia can lead fulfilling lives. Thank you for watching, and don't forget to like, comment, and subscribe for more videos on mental health.